Welcome to our course of medical imaging anatomy. We will be conducting a series of lectures covering the whole human body imaging anatomy. Our first section will be the brain imaging anatomy. In this section, we will be covering the ventricular system and CSF spaces, the blood supply to the brain and the venous drainage system, the basal nuclei and major white matter tracts, the cerebrum and cerebellum, the cranial nerves, the pituitary gland, and the juxtacellular structures. So we'll be starting with the ventricular system and CSF spaces. As we know, our brain is floating within cerebral spinal fluid. This CSF fluid fills the ventricles and the interconnections between them and some other cisterns. That's what we will cover in this section. The interconnections between these ventricles are called foramini. We will know each of them shortly. And then the ventricular system is in continuation with the central spinal canal. The ventricles that make up the ventricular system are the two lateral ventricles, the third ventricle, and the fourth ventricle. And the interconnections between these ventricles are the interventricular foramen, which is also called the foramen of Monro. This foramen is connecting the two lateral ventricles to the third ventricle. And then the cerebral aqueduct or foramen of Sylvius is the foramen that connects the third ventricle with the fourth ventricle. The fourth ventricle is then in connections with some arachnoid cisterns and in continuation with the central spinal canals via some other foramini. These are the median aperture or foramen of Magendie. This is a foramen that connects the fourth ventricle with the cisterna magna. And two lateral apertures or two foramini of Luschka. These are the foramini that connect the fourth ventricle with the quadrigeminal cistern. This illustration here shows the ventricular system and the interconnections between them. So superiorly we have the lateral ventricles. The lateral ventricles are composed of anterior horn or frontal horn, which lies within the frontal lobe, the body of lateral ventricles, the atrium of the lateral ventricles, the occipital horn, which lies within the occipital lobe, or it's called the posterior horn, and the temporal horn that lies within the temporal lobe. The two foramini that connect the two lateral ventricles with the third ventricle are called the interventricular foramen or foramen of Monro. This is then the third ventricle. At the middle of third ventricle, there is the interthalamic adhesion. This is a soft tissue structure that connects the two thalami. It's passing through the third ventricle. This is the shape of the third ventricle. It has some anterior and posterior recesses. So here it has the supraoptic recess, which lies superior to the optic chiasm, the infundibular recess, which lies superior to the infundibular stalk of the pituitary gland. Posteriorly, it has these two recesses, the suprapineal recess and the pineal recess here. Then the third ventricle is in connection with the fourth ventricle via the cerebral aqueduct. This is the location of cerebral aqueduct. And then this is the fourth ventricle, which lies anterior to the cerebellum and posterior to the brainstem. The fourth ventricle are then having several openings. These are the lateral apertures, and this is the median aperture. The median aperture connects the fourth ventricle with the cisterna magna posteriorly, and the lateral apertures connect the fourth ventricle with the quadrigeminal cistern. This is the same illustration, but in anterior view. These are the two lateral ventricles. This is the location of foramen of Monro or interventricular foramen. This is the third ventricle. This is the cerebral aqueduct, the fourth ventricle, the two lateral apertures, and the median aperture. This is a coronal brain figure. These are the two anterior horns of the lateral ventricles. This is the third ventricle here. This illustration shows the CSF circulation. As we know, CSF is produced from the choroid plexus. It fills the third ventricle. It goes through the interventricular foramen to the third ventricle, and then through the cerebral aqueduct to the fourth ventricle, and then via the lateral and median apertures to the other arachnoid cisterns and to the cisterna magna, and it goes all the way down to the spinal canal. This CSF circulation is then passing around the spinal cord, the cerebellum, and on the surface of the brain, and then reabsorbed by the arachnoid granulations, which are found on the surface of the brain and within the dural venous sinuses. This is a sagittal brain CT ventriculography, in which the contrast media is administered to the ventricular system. It shows here the lateral ventricle, the third ventricle here, the cerebral aqueduct, and the fourth ventricle. This is a T1MR image. The CSF is seen dark or hypointense on T1MR image. This is the lateral ventricle, the third ventricle, and this is the interthalamic adhesion. This is the adhesion that we mentioned that passes from or between the two thalami through the third ventricle. This is the cerebral aqueduct or aqueduct of Sylvius. This is the fourth ventricle, and this is the midline foramen that connects the fourth ventricle with the spinal canal, with the central spinal canal. This is a CT series of brain axial images. We start from lower up. This is the location of fourth ventricle, fourth ventricle, fourth ventricle, and here we start to see the third ventricle and the anterior horns of the lateral ventricles. These are the anterior horns of the lateral ventricle. This is the third ventricle here, and this is the posterior horn or occipital horn. Within the temporal lobe, we see here the temporal horn of the lateral ventricles. This is a coronal brain MR image, T2 MR image. We see the CSF here very hyper intense. These are the lateral ventricles, the anterior horns, the third ventricle, and the fourth ventricle. This is supposed to be the location of cisterna magna. This is a normal variation that we should know. Therefore, we can differentiate it from some similar pathologies. The Bok-Dalek's flower basket is a normal variation in which there is a protrusion of calcified choroid tissue through the foramina of Luschka. These are the lateral apertures of the fourth ventricle. This normal variation can be confused with subarachnoid hemorrhage. So it's important to differentiate these two conditions. This is a case of Bok-Dalek's flower basket. As we see here, these are some calcified choroid plexus that are passing through the lateral apertures of the fourth ventricle. The arachnoid cisterns are also a part of the CSF circulation, and it's important to identify these cisterns since some small pathologies can start with the obliteration of these cisterns. The cisterna magna is the largest of these subarachnoid cisterns. It lies posterior to the cerebellum. We will see this on the images in the next few slides. The prepontine cistern lies anterior to the pons. The supracellular cistern lies superior to the sella turcica surrounding the infundibular stalk of the pituitary gland. The interpeduncular cistern is a cistern between the two cerebral peduncles. Quadrigeminal cistern is the cistern posterior to the quadrigeminal plate. The ambient cistern surrounds the back of the midbrain. The cerebellopontine cistern is the cistern that is at the cerebellopontine angle. And the premedullary cistern is the cistern anterior to the medulla oblongata. The Sylvian cistern is within the Sylvian fissure that is superior to the insular cortex. This is a figure of the sagittal brain. It shows some of these subarachnoid cisterns. This is the location of quadrigeminal cistern. This is the location of cisterna magna, the largest subarachnoid space. This is the prepontine cistern anterior to the pons, and this is the premedullary cistern anterior to the medulla oblongata. This is the interpeduncular cistern, which lies within the two cerebral crura. This is the suprasellar cistern superior to the sella turcica. This is another illustration to show the relation of these basal cisterns. Although it's not true that all of these cisterns are on the same section. This is the brainstem at the center, and on the back side is the ambient cistern on two lateral sides, and the quadrigeminal cistern posteriorly. The interpeduncular cistern lies between the two cerebral peduncles. The prepontine cistern is anterior to the pons, and the suprasellar cistern is superior to the sella turcica. This is a T2MR image of the brain, shows some of these subarachnoid cisterns. This is the location of suprasellar cistern. This is the interpeduncular cistern between the two cerebral peduncles. This is the ambient cistern on the lateral surface of the midbrain. This is the quadrigeminal cistern posterior to the quadrigeminal plate. This is the location of the fourth ventricle anterior to the cerebellum, and this is the prepontine cistern anterior to the pons. This is a sagittal T2MR image. This is the location of quadrigeminal cistern, the cisterna magna, the largest one here, the suprasellar cistern and superior to the sella turcica, the interpeduncular cistern, the prepontine cistern anterior to the pons. We move on to talk about the blood supply and the venous drainage of the brain. We know that the brain is supplied via two systems. These are the internal carotid artery and the vertebrobasal artery. We start with the internal carotid artery, which is a terminal branch of the common carotid artery. As we know, the common carotid artery bifurcates at the level between C3 and C5 to form the internal and external carotid arteries. But there is a wide variation of the origin of the internal carotid artery. This varies between C1 and C7. So normally in most of the population it's between C3 and C5, but it can be more superiorly or more inferiorly. The internal carotid artery is divided into several segments. This is a mnemonic to help remember these segments. The mnemonic is: come on please, learn carotid clinical organizing classification. C refer to the cervical segment, and the P to the petrous segment. The L is for the lateral segment, the C for the cavernous, and the other C is for clinoid segment. The O is for the ophthalmic segment, and the last one is the terminal segment, which is the communicating segment. The segments of the internal carotid artery are highlighted here in different colors. C1 here is the cervical segment. C2 is the petrous. C3 in yellow is the lacerum. C4 in light green here is the cavernous. And then the sky blue, this small segment, is the clinoid. This is the ophthalmic segment in which the ophthalmic artery branches. And the last segment is the C7, the communicating segment. This is a digital subtraction image to show the internal carotid artery and its segments. C1 is the cervical, C2 the petrous, C3 the lacerum, C4 the cavernous, C5 the clinoid, C6 is the ophthalmic, and this is the ophthalmic artery that branches from this segment. And lastly, the C7 is the communicating segment of the internal carotid artery. There are some variations of the internal carotid artery. We talked about the origin variations. So normally it's originating between C3 and C5, but it could be originating between C1 to C7. Other variations include the asymmetry variation, in which the level of bifurcation and orientation of the origin is different between the two sides of the internal carotid artery. The aberrant internal carotid artery is another variation. In some cases, there is a congenital absence of the internal carotid artery. Retropharyngeal internal carotid artery is another variation, but this is a rare condition. Kissing carotids, in which the two branches of the common carotid artery, which are the internal and external carotid arteries, are tortuous and elongated, and then they touch in the midline. That's why they are called kissing. The persistent carotid vertebral-basilar anastomosis, we will see this condition shortly, and lateralized internal carotid artery. This is a case of congenital absence of internal carotid artery. As we see on the right side, the internal carotid artery is formed and it's normal, but on the left side, we don't see any internal carotid artery. So this is a case of congenital absence of internal carotid artery. This is a kissing carotid condition in which the internal and external carotid arteries are tortuous and elongated. They are almost touching at the midline here. This is a case of persistent trigeminal artery. As we see here, there is a large tortuous vessel that is passing from the internal carotid artery to the basilar artery and then supplying the posterior circulation. This is not supposed to be here. This is another image of persistent trigeminal artery. This is the basilar artery and this is the internal carotid artery. This connection, this blood vessel between them, is a persistent trigeminal artery. This trigeminal artery is found in the embryologic age, but after birth it's not supposed to be there. This is another case of persistent hypoglossal. This is a persistent hypoglossal artery, as we see here, the one that is with the red arrow. This is the hypoglossal artery. Normally, there is no connection between the internal carotid artery and the basilar artery at this level. The second system that supplies the brain with the blood is the vertebro-basilar system. So we start to talk about the vertebral artery that originate from the first part of the subclavian artery, and it ascends posterior the internal carotid artery in the transverse foramina of the cervical vertebrae. It has several branches, include the numerous small branches, the radicular and spinal branches, and the posterior inferior cerebellar artery. This is one of the most important blood supply to the cerebellum. When we talk about the cerebellum, we will talk about the blood supply to it. Then the vertebral arteries terminate, in which they combine to form the basilar artery. The key relationship of the vertebral artery with the other structures that its course is posterior to the internal carotid artery. It ascends anterior to the root of the hypoglossal nerve, which is the cranial nerve number 12. This is an image to show the course of the vertebral artery and its segment. The first segment, V1 segment or preforaminal segment, is the segment between the origin of the vertebral artery from the subclavian artery to the location before it enters the transverse foramen of the cervical vertebrae. Then the segment that lies within the transverse foramen of the vertebral bodies is called the foraminal segment or V2 segment. The third segment is from C2 to the dura. From C2 to the location where it enters the dura. The last segment, the V4, is the intradural segment. This is the segment intracranial. The variations of the vertebral artery include asymmetry, maybe due to hypoplasia, absence of one of the vertebral arteries, or termination into the posterior inferior cerebellar artery of one of the vertebral arteries. Complete or partial vertebral artery duplication is another variation. Fenestration, which is a segmental duplication, is another variation. There is a variable origin of the vertebral arteries. Normally, they should be originating from the first part of the subclavian artery, but in some cases, it's originating from either the aortic arch or it could be the second, not the first branch of the subclavian artery. Another variation is the variation of the ostium, which is the opening of the vertebral artery. In most of the cases, it's either cranial or posterior, in which the opening of the vertebral artery lies on the superior surface or the posterior surface of the subclavian artery. But in some fewer cases, it could be caudal or interior, in which the opening of the vertebral artery lies on the inferior or anterior surface of the subclavian artery. This is a case of vertebral artery in which originating from the aortic arch. This is the aortic arch, and this is the left subclavian artery, and this is the right subclavian artery. The right one is normally originating from the right subclavian artery, but the left one is originating from the aortic arch, as we see here. This is a case of fenestration of vertebral artery, in which there is a segmental duplication of the vertebral artery. This is a case of hypoplastic left vertebral artery. We see the right one is normal in thickness and smooth, but the left one is very thin and irregular. So this is a case of hypoplastic left vertebral artery. This is the case of vertebral artery partial duplication, in which there is two branches of the vertebral artery, one of them originating from the aortic arch and one of them is originating from the subclavian artery. Then they merge to form one vertebral artery. We move up to talk about the circle of Willis. The circle of Willis is an arterial polygon formed by the internal carotid and vertebral basilar system anastomosis. This anastomosis lies around the optic chiasm and infundibula of the pituitary stalk within the suprasellar system. Therefore, the circle of Willis is divided into two parts, the anterior circulation and posterior circulation. The anterior circulation is formed by the left and right internal carotid artery, the A1 segment of the left and right anterior cerebral artery, and the single anterior communicating artery. The posterior circulation is formed by the left and right posterior communicating artery, the P1 segment of the left and right posterior cerebral arteries, and the single basilar artery, which forms the tip of the circle of Willis. This is an illustration of the circle of Willis. This is the tip of circle of Willis formed by the basilar artery. The posterior circulation is formed by the posterior communicating artery here, the P1 segment of the posterior cerebral artery here, and the basilar artery at the tip of the circle of Willis. And then the anterior circulation is formed by the left and right internal carotid arteries, the A1 segment of the anterior cerebral arteries, and the single anterior communicating artery. It's important to know that circle of Willis is normal in only about 25% of population, but in most of the people it has some variations. Some of the common variations of the circle of Willis include hypoplasia of one or both posterior communicating artery, origination of posterior cerebral artery from the internal carotid artery rather than the basilar artery. So in this case, there will be an absent or hypoplastic P1 segment. This is called the fetal posterior communicating artery. Another variation is the hypoplastic or absent A1 segment of the anterior cerebral artery, absent or fenestrated anterior communicating artery, and infundibular dilatation of the posterior communicating origin. Here we take a look at some common variations of the circle of Willis. In this case, we see that there is hypoplastic or absent A1 segment of the anterior cerebral artery. Here we see an absent anterior communicating artery, which is supposed to be here between the two anterior cerebral arteries. This is a case of duplicated anterior communicating artery. This is a case of ezygous anterior cerebral artery, in which the two sides of the anterior cerebral arteries are combined to form one anterior cerebral artery. This is a case of hypoplastic or absent posterior communicating artery. And this is a case of fetal posterior cerebral artery, in which the posterior cerebral artery on the right side is originating from the right internal carotid artery rather than the basilar artery. And then the P1 segment in this case is absent. This is a case of hypoplastic P1 segment. This is the first segment of the posterior cerebral artery. Here we take a look at the segments of the cerebral arteries. Starting from the middle cerebral artery, it has 4 segments. The M1 segment, which extends from the internal cerebral artery, internal carotid artery termination to the origin of the sylvian of fissure, Then M2 segment starts from the bottom of the sylvian fissure to the distal of the sylvian fissure. And then M3 extends from the top of the sylvian fissure to the bottom of sylvian fissure distally. So M2 is proximal and M3 is distal. M4 represents the small cortical branches of the middle cerebral artery. This is another illustration to show the segments of middle cerebral artery and the anterior cerebral artery. The M1 extends from the origin here to the bottom of the sylvian fissure, and then M2 from the bottom of the sylvian fissure to the top of sylvian fissure proximally, M3 from the top of sylvian fissure to the distal bottom of the sylvian fissure, and M4 is the cortical branches of the middle cerebral artery. The anterior cerebral artery segments include A1, which extends from the origin, from the internal carotid artery, to the location where the anterior communicating artery is positioned. Then A2 is distally. We will talk about A2 and A3 in the next few slides. So the A1 segment of the anterior cerebral artery originates from the internal carotid artery to the anterior communicating artery. This has about 14 millimeter in length. A2 is lying vertically from the anterior communicating artery to the origin of the callosal-marginal artery. The A3, which is the callosal segment, this is distal to the origin of the callosal-marginal artery. This illustration shows the A2 and A3. We already saw A1. A2 is this one, which extends from the anterior communicating artery to the location before the branching of callosal-marginal artery. And A3, which is the callosal segment, is the callosal-marginal artery and its branches. The segments of the posterior cerebral arteries are 4 segments. The first segment, P1, originate from the origin at the termination of the basilar artery to the posterior communication artery within the interpeduncular system. And then P2 from the posterior communicating artery around the midbrain, and then divided into 2 parts, proximally P2A and distally the P2B. P2A lies within the crural cistern and P2B lies within the ambient cistern. P3 lies within the quadrigeminal system, and the P4 is then the cortical segments of the posterior cerebral artery. This illustration shows the segments of posterior cerebral artery. This is P1 here, from the origin of posterior cerebral artery from basilar artery to the location where it combined with the posterior communicating artery. Then P2 is here, highlighted in blue and green. This is P2A and this is P2P. P2A lies within the crural system and P2B within the ambient system. Distally within the quadrigeminal system is P3 and P4 are the branches of the posterior cerebral artery. This illustration here shows the territories of the cortical vessels. On the lateral surface of the brain, the most anterior part is supplied by the anterior cerebral artery, and most of the lateral part is supplied by the middle cerebral artery, including the superior area of the temporal lobe and the anterior area of the parietal lobe. And then most of the posterior area include the posterior area of the parietal lobe, the occipital lobe, and the inferior area of the temporal lobe, are supplied by the posterior cerebral artery. On the medial surface, most of the medial surface of the brain is supplied by the anterior cerebral artery, including the frontal lobe and the anterior area of the parietal lobe. The occipital lobe is supplied by the posterior cerebral artery, and here a small portion, which is the superior portion of the temporal lobe, is supplied by the middle cerebral artery. We move on to talk about the cerebral venous sinuses. These are the venous sinuses and the cerebral veins, including superficial and deep cerebral veins that drain the cerebral venous blood back to the systemic circulation. This illustration here shows the dural venous sinuses, including the largest one, which is the superior sagittal sinus, and the straight sinus, inferior sagittal sinus, parallel to it and more inferiorly. This is the area where they confluent. This is the transverse sinus, the sigmoid sinus, and then they drain to the jugular vein. This is the location of cavernous sinus. We will talk about cavernous sinus in the next lectures. This is another illustration to show the relation between the dural venous sinuses with the surrounding structure. The superior sagittal sinus lies just inferior to the cranium. Inferiorly, we have the straight sinus and the inferior sagittal sinus, the great cerebral vein or vein of Galen. This is the area of confluence. It's called the confluence of sinuses or the turcular hierophyly. This is the transverse sinus, the sigmoid sinus, and then all the way down to the jugular vein. This is a CT venography in which the contrast media is administered to the venous system, the cerebral venous system. This is the location of superior sagittal sinus. This is the straight sinus, the inferior sagittal sinus, the vein of Galen or the great cerebral vein, and this is the turcular hierophyly or the confluence of the sinuses. This is an axial maximum intensity projection through the cerebral vein. It shows the straight vein, the vein of Galen here, the transverse veins, and the sinus confluence. So this is all about the first lecture of brain imaging anatomy, and we will see you in the next few lectures, continuing with the imaging anatomy of the brain, and then all the way down covering the whole body imaging anatomy. Thank you.